The following is a special presentation of Tony Kurre Radio. From hot dogs to cool kitties, this is Darkside of the Pooch.
Oh, Dr. Rab, what you got? That's kind of short and sweet. Dr. Rab Stewart, he's our little kitty cats, hot dogs and cool kitties. Darkside of the Pooch. Every Monday it runs at noon and 8. And, of course, it runs on Spotify. Go to Spotify, search Tony Kurre Radio. It's with a K. And you can listen to all the Darkside of the Pooch episodes. One of our favorite parts of this show is Mutt Mail. And just keep the Mutt Mail coming, man. Go to TonyKurreRadio.net. Become a bonehead and give me your email questions. And, of course, always brought to you by Ed's Pet World, a 47-year-old family bone business. I think it's probably closer to 50 years now. Specialized in exotic pets, pet exhibitions, service since 1974. The new special pet could include lizards, red-tailed boas, chameleons, bearded dragons, birds, parakeets, Amazon parrots that even talk, rabbits, chinchillas, ferrets, and even more. They'll make sure your special exotic pet is healthy, and they'll teach you how to keep it healthy. They also, of course, have a multitude of great toys. I mean, Seth gets after it. He's a passion for collective vintage and modern toys. Comes through their collection of figurines, pops, various items, specialty watches, Star Wars stuff, and more. Buy, sell, or trade. Check out the wonderful Ed's Pet World, proud sponsor of Darkside of the Pooch, 879-1331, 879-1331. He is Dr. Rab Stewart. We got some killer questions for you today. What's going on in the world of the Rossbridge Animal Hospital? Last week you were super busy with gallstones, correct?
Bladder
stones, yes. Anything super exciting going on in your world this week?
This week's been pretty typical stuff. I don't have anything, at least that I remember, that's real wild and crazy this week.
Okay, all right. Well, I got a couple of things that I'm going to throw your way here right off the top of the show. I don't know if you've heard about this acute hepatitis virus that has affected 109 kids in our country, and roughly 5 of them, I believe, has passed away. Unfortunately, they're now saying, the CDC, that it could have something to do with dogs. It could be placed off. They said roughly 80% of the children affected by this acute hepatitis virus are also dog owners. Can you tell me anything about some of the diseases, not only this acute hepatitis virus, but any other potential illnesses that can be passed on from animals to humans?
I'm totally out of the loop. I really stay, like, when it comes to news, I'm not a news follower.
Okay.
I think it helps keep me sane.
Yeah.
So anything that's in, like, if it has to do with human news, I usually hear it from you, like today, or I hear it from just like from someone else. So this is all news to me, no pun intended.
Yeah. I'll just read you what it says. A possible link between the unusual number of acute pediatric hepatitis cases and dogs originated with a report last Friday. The UK has reported 163 cases of acute hepatitis in children as of May 3rd. The agency report said that the leading hypothesis is the outbreak is linked with, adenovirus? Or adenovirus?
Yeah, adenovirus.
Adenovirus, a common virus that usually causes mild cold or flu symptoms. But the report also says it's looking at the exposure to other environmental factors, including family pet ownership of those dogs. Have you ever heard of any situation where a dog could pass along some type of virus to a child that would create a hepatitis situation? This
is a fantastic question.
Yeah.
So it's going to lead into something that's going on here in Birmingham too.
Yes.
That's on the dog side. So adenovirus is something that we do vaccinate for in dogs. It's a common vaccine, and it's a common virus that is wrapped up in the parvo and distemper vaccine that we give. Mm-hmm. So hepatitis, adenovirus, parvovirus, all these things are wrapped up in this one vaccine. So, I mean, we know that dogs can get adenovirus, and if they believe that is leading to hepatitis in kids, I mean, it's not out of the realm of possibility. I guess that it could be caused by a pet that might have adenovirus. But again, I'm no immunologist, and I'm certainly not a human doctor, although people try to get me to be all the time. I am not qualified to be that, and you don't want me to be that.
Yeah.
Yeah, I mean, it seems plausible, because we know that dogs get that virus, but also in Birmingham city limits, and really not far from where our office is in Hoover, at Greater Birmingham Humane Society, they have found a lot of dogs that have distemper. And so I mentioned distemper is also a virus that's wrapped up in this vaccine that we give. So there's been, in the wild dog population here in Birmingham, somewhat of an outbreak of distemper, and that has bled over into the domesticated dogs, or maybe the dogs that are, not technically wild dogs, but maybe a little bit feral, that are out on their own. And so they're coming in contact with these wild dogs that have distemper. And now that's getting into the pet population here in town. And the Humane Society, which always does such a great job with everything that they do. They're doing a good job to control this outbreak, but they have stumbled upon several dogs that are distemper positive.
I know that we went through a parvo situation with one of our dogs we got from a breeder, and it was heart-wrenching, and it was too late by the time we brought him in. As long as your dog is immunized correctly for everything, any reason your dog can't be around another dog, maybe at a doodah day, maybe they're bringing your dogs to the stadium, whatever, bringing your dog to work, all good there?
Yeah, you shouldn't worry. If they're vaccinated, you shouldn't worry. Okay. The vaccines, we've learned a lot about vaccines over the past couple of years, as a whole with COVID, and the vaccines that we give to dogs are more effective than the vaccine that people take for COVID-19. It's more effective at stopping viruses and preventing any symptoms at all, and it's more effective in limiting symptoms should they actually contract the virus, because that is still possible. Even if you're vaccinated, even if these dogs are vaccinated against something, they can still get the virus. But the hope is that they obviously don't get it, and if they do get it, you would never know it because their symptoms would be mild, if any. But if they do become symptomatic, the symptoms should be so mild that they don't really have any issues. But if your dog's fully vaccinated, then you really shouldn't worry about taking it places, because that's what the vaccines are for, is to keep you safe and keep your pet safe and be sure that you can get out and do things. So if you have a dog that's not vaccinated, then I would strongly encourage you to get that dog and cat vaccinated, and definitely isolate them from other pets until they are.
Go to Spotify, search Tony Kurre Radio. That's Kurre with a K, Kurre, or search Darkside of the Pooch. I can promise you this is the only Spotify podcast called Darkside of the Pooch. You can listen to plenty of episodes. We probably have 30 or 35 episodes up of Dr. Rab Stewart, Rossbridge Animal Hospital's owner, and of course the chief veterinarian there. 208-0301, 208-0301, area code 205. Well worth the drive wherever you're coming from to go to Rossbridge and check out Dr. Rab Stewart. And of course you can hear the show live every Monday at noon and 8 right here on Tony Kurre Radio. I asked you this question several months ago. I have a 14-year-old son. He's got special needs. He's in love with Rainer. He calls him Mr. Baby. It is our Australian Shepherd, and he loves to smear food on his face and just have that dog lick him for 10, 15 minutes at a time, inside his mouth, in his ears, in his head. You said there's no problem with that. I've always heard the myth that dogs have less germs than humans. True or not? And is it cool for your dog just to repeatedly lick you inside of your mouth?
No, I mean, I would probably try to deter that as much as you could. Okay. But I mean, I've seen some pretty dirty dog mouths, because, for what we do for a living, we see a lot of dogs and cats that have really advanced tartar buildup on their teeth because the owners have neglected their dental care for 10, 12, 13 years. Mm-hmm. And so, I mean, if you could just imagine like if you ever see concrete being poured, so just imagine a nice clean tooth, and this tartar looks like brown concrete that you would have just poured and slathered all over your dog or cat's mouth and teeth. Yeah. So in situations like that, I would say that a dog mouth has about 1 billion times more bacteria than mine does.
Really? Okay, there you have it. Straight from the man's mouth. Dr. Rab Stewart here at Darkside of the Pooch. That's disgusting. I've never seen brown concrete before, but thanks for that look. It sounds like the inside of a diaper is what it sounds like. All right, one final story before we get into Mutt Mail. We get some great questions today. Couple up in Barnstable, Massachusetts last week. Found a puppy on the side of the road. They took it home, had no collar on it, and they started raising it. And for about 2 weeks, they actually had this pup and then realized it was a coyote. How cool would that be, first of all, to have a coyote pup in the family? They did take it to a wildlife rescue. But would Dr. Rab keep a coyote? Would that be an issue?
I probably would not keep a coyote.
If someone brought a coyote to Rossbridge Animal Hospital on the down low, obviously, is there anything you can do to it to ensure that if it bit you, you wouldn't have any issues? You could check it for rabies, right? You could do whatever you wanted to.
Well, we couldn't because we're not a wildlife.
That's what I said. That's what I said on the down low. That's what I said out the back door.
Yeah,
on the back door.
There is no down low or back door.
Oh, I got you. you treated giraffes. Yeah.
Officially, there is no back door.
Okay.
Or down low. But in a world where there weren't rules and regulations.
Yes.
Maybe
that's my world. Yes.
Okay, we're living in the Tony Curre Radio Network world,
yes,
where there are no regulations on this sort of thing, and we're in the middle of somewhere very remote, but we have been dropped into that area. Then, from I guess from a species standpoint, a wild dog is not that much different than a domesticated dog, really, if at all.
Okay.
So we could check it for parasites, and we could be sure that it was free of parasites, both internally and externally. We could vaccinate it against rabies. We could do all those things because coyotes are very similar to our domesticated dogs. So from a standpoint of, does the medicine translate? Then yeah, the medicine translates, but And if we left the Tony Curre Radio Network world and came back into our real world, there would be nothing that I could do with a coyote.
Yeah, okay. I thank you you've certainly made it clear that you would never treat a coyote. All right, so you're looking at a coyote pup. Do you know right away it's a coyote? And what's the one thing that you're looking at going, that's a coyote?
I don't think that you do know, because these when you have a puppy, let's say you have a 6-week-old puppy.
Yeah.
I mean, obviously, there are you can look at that dog and say that it is one of these, 8 to 10 breeds. And I'm just throwing a number out there.
Mm-hmm.
But until they start to grow and until they start to get, we're talking several months old, those defining characteristics of the breed may not be visible. So for example, a lab puppy and certain golden retriever puppies look very similar, if not identical.
Okay.
So if you have a coyote and it's 4 weeks old, or if it's newborn, I would say, again, this is a little bit of guesswork because I've never seen a coyote pup, but from the time it's born until it's probably maybe 12 or 16 weeks, it's going to look like just a regular old dog.
It's adorable.
It's going to look like a puppy. It's going to look like several different breeds.
Yeah.
So I could see that you could make that mistake.
All right. Rossbridge Animal Hospital's Dr. Rab Stewart. He answers all your questions. All you got to do is email us, TonyCurryRadio.net, TonyCurryRadio.net. Become a bonehead and leave your email questions, 208-0301. Of course, all over social media, the Rossbridge Animal Hospital on Facebook, and also at Rossbridge Vet on Twitter. Bob in Birmingham and Mutt Mail. Do dogs have belly buttons? And if they do, can they have outies? And does that mean that maybe your dog has a hernia?
Yeah. The answer to all of those questions is yes. They have a belly button, and dogs don't have any, not A-N-Y, but I don't even know how you would, they don't have any belly buttons like we do. Most people have the innies.
Yeah. They
have a flat, little spot where their umbilicus is, or where their umbilical cord attached to them when they were puppies. So if you flip them on their back and you look very closely, it is probably about 0.5 centimeter to 1 centimeter long, depending on the size dog. and it's right in the middle of their abdomen, and it just the skin looks a little bit different than the rest of the skin on the abdomen. It's almost like a little diamond shape. Like if you kind of stretched out a diamond, that's what it looks like. That's the umbilicus. And so if you have a dog that has a bulge right there, then that is a umbilical hernia. And an umbilical hernia is where the muscle of the abdominal muscles there, they didn't close properly, and there's a little hole there. And most of the time, it's not a big deal. The hole can be big enough to where a little bit of fat from the abdomen comes out, but not big enough where any important organs come out. I mean, it can be big enough to where if you get a loop of small bowel through it, then that can be kind of dangerous because it can get strangulated and the blood supply can be cut off. And then that part of the bowel would die, and then you'd have a really big problem.
Mm-hmm.
But usually it's not a big deal. So yes, to Bob in Birmingham.
I have a herniated belly button myself, and I've been told that as long as I don't experience any pain, that it's okay. It looks kind of weird because I have an in and outie, which is kind of strange, but so there you have it.
Yeah.
So you learn. So is the umbilical cord, the umbilicus, used the same way as a humans? Is that how the animals are fed? And is it just detach inside the womb? How's that come off?
Yeah, it's just like in people, except, usually with dogs, there are several dogs per litter, most of the time. Uh-huh. And so, there's several of those cords. And when they're born, the puppies rupture out of a little sac. And if they're delivered at home, then the mother knows exactly what to do, and she will take care of the cord. If they are delivered by C-section. So
hold it back up real quick. The umbilical cord goes inside the sac, or is it actually going into the dog? Is that what the dog chews off the sac around the animal? Is that part of that?
Yeah, all that stuff's gonna come off. It's gonna be removed by the mother. All that stuff.
Gotcha.
And then afterwards, the placenta is gonna come out. So all the puppies come out. All the puppies are born, and then the placenta is gonna come out after that.
I gotcha.
But if there's a like in the office, like if we were to deliver some animals via C-section, then we would clamp the cord and we would cut it off like you would normally, how everyone pictures newborn babies being born, right. clamping the cord, and then either the doctor or the dad cuts the umbilical cord.
Gotcha. All right, Dr. Rab Stewart, Rossburg Animal Hospital's Darkside the Pooch. We air it live every Monday right here on Tony Curry Radio at noon or 8, also on Spotify. It's absolutely free. Go to Spotify, no subscription or anything like that stuff. Just go to Spotify, search Tony Curry Radio. You can hear all of our shows right here on Darkside the Pooch. Layla in Henderson County, Nevada says, why does my cat always stick its butt in my face when I sit near it?
I don't really know. I think that the only speculation that I could say is dogs and cats, they familiarize themselves with other dogs and cats by sniffing butts. Mm-hmm. Dogs do it and cats do it. So this is purely speculation, but I would think that would be a form of affection. Like the cat wants to get to know whoever they're doing that to, and they want whoever is doing that to know them. So like the cat saying, come and, get familiar with me. I like you. Let's be friends. Okay.
There you go. Steve in Orange Beach says he's seen the car commercial where the cat is acting like a dog. Have you seen it? It's digging some guy that's caught in an avalanche. It's swimming. It's fetching sticks and everything else. He goes, what's the real deal with cats and water? He said his cat actually likes to go in water. He said he doesn't put the cat in the water. It actually goes in itself. It'll go up to its belly, then it gets out. But what's up with cats and water?
I think it just depends on the cat, just like it depends on the dog. I think there is a less percentage of cats that like water, but there are still cats that like water. And there's a greater percentage of dogs that like water, but there's still dogs that don't like water. I've had dogs that love water. They'll get in it any chance they get. And then I've had dogs that, have a strong aversion to it, and they don't get them anywhere near it. They're going to put the brakes on and they're going to run away. But I've had cats that I've never had a cat that likes to get in and swim. Yeah. But these cat videos that you see online all the time. There's cats that will get in deep water and swim across it. But cats they'll I've seen a lot of cats around bird baths. They're dipping their paws in. Some cats will drink from their paw. So I think that the cats like hating water and being scared of water, I don't think is as common or strong as what the stereotype says.
You ever seen the cat videos where they're sitting on top of the aquarium and they fall in? Those are hilarious.
Yeah, those are funny.
Those are some of the funniest things I've ever seen. All right, this is Mutt Mail. Go to TonyCurryRadio.net, TonyCurryRadio.net, and drop your emails. And we have somewhere between 50 and 100 every single week. I pick out some of the favorites. And, of course, if you don't hear your questions, probably because we've answered before. We'll get back to it. Taylor in West End wants to know, do cats lick people? She said, obviously, my dog does. But I haven't. She said she's talked to her vet in West End. He says that when your cat actually licks you, it's actually grooming you, and it's a compliment. True?
Yeah, I could get on board with that. And I've had several cats, and all of them from time to time have licked me, and it's not as common as when a dog does it. But cats do, just like dogs, they do a lot of grooming with their mouths. They probably do more grooming with their mouths than dogs do. They have that rough tongue that can help keep their coat from getting matted up and things like that. So I think a cat is driven to groom itself by licking. And so it would make sense that when they lick us, they're trying to, groom.
Cats are pretty amazing animals, aren't they?
Yeah, I like when that rough tongue. It's pretty cool.
Yeah, it is.
I mean, it's just an interesting feature.
There's no doubt. Darkside the Pooch, brought to you by Ed's Pet World, around for nearly 50 years. I do all my shopping down there, and I've gotten my ball boa down there. I've got my hedgehogs down there, my chinchillas, my cotamundes. They got it all, man. They even have caiman alligators down there. Give me a call, 205-879-1331, 879-1331. You ever heard of vitiligo?
Vitiligo?
Vitiligo, yes. Did I say it wrong? Vitiligo? Explain to people.
We're in. I think we're in the Tony. We're in the Tony Curry Radio Network world. So you can say it however you want. I'm going to start saying it how you say it.
Vitiligo sounds a lot better than. How do you say it?
Vitiligo. That's what Michael Jackson supposedly had, and that's why that's what he always said, that he had vitiligo, because it's lightening of the skin. So I think a lot of people, at least my age, they may understand when you put it into those terms. It's where your skin lacks pigment.
There you go. Well, according to Ron, who is in Nashville, Tennessee, he's in an argument with his wife about how their dog, as it's become a little older, is getting vitiligo, and that is to say that its fur pattern is starting to get more white on its face. And she's like, no, it's not. And he's like, yeah, it's actually growing gray. Is it gray hair? Is it only happening with older animals? And because obviously we all want to have that dog that looks asymmetric. The eyes are black and it's got the white down the middle of the nose. But how common is that? Does it happen to every animal?
So there's a difference between vitiligo and their hair turning gray. Vitiligo is when the skin itself is getting lighter and not the fur. But both of those things can happen in pets. So if it's graying of the hair, then that's just like us. That's just the hair turning gray. It's not vitiligo. But one of the most common places that you will see vitiligo is around the muzzle and the nose, probably because those are hairless spots. And so you're going to be able to see that skin a lot more easily than you would other parts of the body. But their nose will turn from black to white. And that's vitiligo. It's the actual skin changing color.
That's pretty crazy. That's pretty wild. I love that. I'm showing my producer right now a video of Maxie, one of my dogs, giving birth to one of its pups, because he wanted to know about this umbilicus situation and how they actually chew we actually took a video of our dog doing that. It was on my wife's pillow, thank goodness, while I was taking a nap, which is pretty amazing stuff. All right, and finally, before we got to go, and I love the show, it goes by so quick. A lot of people talking about, and we talked about heartworm last week and fleas and ticks. I know a lot of people, and you should give your animals, flea and tick. I do with this Breveco, which is great because it lasts 3 months. The heartworm every single month. But I know a lot of people want to wait because maybe they're short on cash or whatever until the dog actually starts scratching. And if you've ever had a flea infestation in your house, it sucks. It's the worst thing because you basically have to firebomb the entire place. The first time you see one of those little jumping boogers, good night. Talk about the flea and tick season, because as it gets warmer, it's coming, and it's year round.
Yeah, that's right. That's right. So fleas and ticks we see fleas and ticks in our patients year round because it doesn't get cold enough to kill those things off. Ticks are fairly hardy, and they can live on vegetation for, through the cold months. They can live on vegetation for a little while and just kind of wait it out. And then they'll have either a domesticated animal or a wild animal walk by, and they'll just bail off and get on that animal. And then they can easily survive our kind of milder temperatures doing that. And fleas are the same way. I mean, we see fleas on pets of course, in the hottest part of August, and we see them in the coldest month of February. So it's always flea and tick season here. And the bad things about fleas and ticks, they carry diseases that we can get. So they can pass along bacterial infections to your dog, but they can also pass along bacterial infections to you. Plague is still, it's a bacteria that people can get today, just like they did, centuries ago. And so that's dangerous. You get that from fleas. We see that more in areas of the country where they have a prairie dog. For whatever reason, prairie dogs are the poster child for getting plague. So Colorado had a really bad outbreak of it a few years ago. But ticks carry a lot of tick-borne illnesses, Lyme disease, Rocky Mountain spotted fever, Ehrlichia, all that stuff. People are pretty familiar with the diseases that ticks can cause. So, giving preventatives is a lot easier. It's easier to prevent fleas and ticks than it is to treat the diseases that they cause. And then heartworms, that's a little bit more interesting because heartworms are spread by mosquitoes, and there is a mosquito season here. We don't have mosquitoes when it gets super cold. Yeah. But the trick about mosquitoes is we don't know when we're going to start seeing them. You don't know when you're going to stop seeing them in the fall, and you don't know when you're going to start seeing them in the spring. So, anyone who thinks I'm trying to pull the wool over their eyes can go and look at the American Heartworm Society, and it's year-round prevention is recommended because you don't know when you're going to start seeing mosquitoes, and that's what transmits heartworms is mosquitoes.
There you go. At least according to criticcontrol.com and wideopenspaces.com. I mentioned I had a possum on my front porch a couple of weeks ago. I haven't seen a little booger bear in a while, but according to those two sites, possums can eat an average of 5,500 tick larvae per week. So they're unsung heroes. It's absolutely disgusting. Now you look at some other websites and they say it's a myth, but I'm gonna assume it is because I know every animal's put on this earth for a reason. Even mosquitoes and fire ants. There's a reason why we have those nasty little bugs. All right, great show as always. Tell people how they can find you, and we'll catch back up again next Monday. But to tell everybody where you're at and what you do.
Yeah, you can find us on Facebook, Ross Bridge Animal Hospital. You can, our website's rossbridgevet.com, and you can call us at 205-208-0301.
Do you ever post any of your surgeries?
I don't.
You should.
Well, the reason I don't is because pretty much any surgery that we do is already online from somebody somewhere.
Yeah, but it's you.
That's true. It is. And I guess I always worry a little bit that it's going to gross somebody out. But then again, they don't have to click on it.
Yeah, exactly. There he is, Dr. Rab Stewart, brought to you by Ed's Pet World for 50 years, based right here in Birmingham, down at home. What I always tell people, it's the minute you come into Birmingham, if you're wondering what Birmingham's all about, you got to stop by Ed's Pet World, stop by Vulcan, stop by the Civil Rights Museum, and make sure you check out the wonderful Ed's Pet World. They've been in business for over 50 years. They do all kinds of great exotic pets. The kids absolutely love it down there. It's unbelievable. They have everything from Amazon parrots to geckos to chameleons, bearded dragons, tarantulas, the whole 9 yards. Plus, Seth loves his toys, and he goes all over the country to find some of the collection of figurines, pops, various items still in the boxes, watches the whole 9 yards. They buy, sell, and trade. So if you find some old stuff and you want to take it down there and find out what it's worth, check out Ed's Pet World, 879-1331, 879-1331. Dr. Rab, until next week, I love you. Great job, and we'll look forward to seeing you.
Talk to you next time.
Thank you, brother.
This has been a special presentation of Tony Curry Radio.